College of Education and Human Development, Dean Jorge Delva from the Boston University School of Social Work, Dean Sandra Galea from the Boston University School of Public Health, and then Dean Christopher Moore from the Boston University College of Health and Rehabilitation Sciences, or Sargent. So I'm going to start out. We're just going to go in alphabetical order to make it easy, which Dean Antman, you probably have maybe dreaded or loved for your life, being an A. But we'll start with you, if that's all right.
Thank you very much. It's really a pleasure to participate in this panel. I think it was actually really terrific that the CTSI is taking this on. The panel specifically asked us to give us, actually, somehow it started out at the beginning. They said, is community engagement part of your mission? It is in so many words. This is the BUSM school medicine mission, and it's wordy, but the last several lines articulate a commitment to help the health of our communities. And our strategic goals, number 3, is providing a model for high-value care to our diverse Boston safety net population at Boston Medical Center, our VA and community affiliates. We have 14 community health centers, and lots of our primary care faculty are populate the community health centers as well. We soon will have 4 hospitals on campus, but right now we have 3. Everybody's pretty much aware of Boston Medical Center, which is the safety net hospital for Boston. Healthcare for the homeless, which has 120 basically step-down beds, as well as outpatient facilities. The Fuller Mental Health Center, which is a state facility, and Shattuck Hospital supposedly will be coming here in Q3 of 2024. They're currently doing the construction, and it does make it great to have a place, many places for our medical students to gain medical experience and for our graduate students to do research. We certainly have as one of our major values addressing health disparities. It starts pretty much day 1 of orientation for our students, both graduate and medical schools. The BMC has the mantra, exceptional care without exception. We have pediatric, geriatric, and family medicine health calls. Our pediatric department has Children of the City. They took a lead in read for the early reading programs that went national, and also for collaborations with lawyers for getting housing cleaned up so that kids didn't have asthma. We have healthcare for the homeless immersion experience, advocacy programs, the Outreach Van Project, where the students and faculty go out and give prescriptions, warm clothes, soup, whatever, to homeless people who are throughout the city. Cancer, heart disease, stroke, arthritis, and other clinical centers, and Boston Center for Refugee Health and Human Rights. Right now, they have a fair number of Haitian refugees because of what's happening there, and we're actually expecting a fair number of Afghans starting this week. Our students start orientation with a bus trip to our community health centers. At orientation, they find out that we have many communities in Boston, many ethnic communities in Boston. Some of them are Albanian, some of them are Senegalese. Everybody kind of knows about the Irish and the Italians, but they don't know about the others. They are required to work with a community group as part of their first year curriculum. We get and are required to get community input into our research needs. It's required for our clinical translational science grant and for other NCI and NIH funded centers. So we have to do it. So if we weren't doing it, we would have to do it anyway. And therefore we have a number of community input committees into our research programs. Our faculty actually develop national and international reputations and thus are promoted by publishing model programs. Certainly our addiction programs have published a number of papers on things that interventions that worked and unfortunately a lot of interventions that didn't show any promise at all. But that's part of academia. They certainly have a national and international reputation in this, and that is the criteria for promotion. We actually have had one faculty member promoted to associate professor. This is not the usual way of getting there, with no publications, but his work had been downloaded more than 33,000 times. And he had letters that stated that he had a national reputation in his field. He wasn't doing it with publications, but boy, did he have really great visuals that everybody downloaded and used. Jake Sullivan, our VP for Boston University of Government and Community Relations, recently codified the 90 or more community programs, resources, and services as part of our medical campus master plan that was just submitted to the city. And therefore, we kind of had them nicely codified for this presentation. So examples, since the dental school dean is not here, we have Smart Smiles. That is an example of a program by the dental school, oral health education and dental services for Boston Public Schools. We have many STEM programs. This is just a few of them in collaboration with the Boston Area Health Education Center. That's a citywide program. For summer, that's 88 students. So that scales really nicely, and it's for high school students. Health professional recruitment and exposure, our HPrep program. Anatomy Academy, Beautiful Brains. I think the faculty have fun, kind of naming these programs, or that the students do. And the MedSci program and Introduction to the Careers in Medicine. These are all programs that the medical students and the faculty are running throughout the year, mostly in the summer. And Jake had made clear that there are 2 BU signature programs, and I guess nobody's here speaking for the university, but these 2 are just absolutely critical to the work that we're doing. Because when we're working with the families of these high school students, we can tell them that if they study and get good grades and they get accepted to BU, they can actually get a scholarship. It makes it totally credible for these families to send their children to the summer programs, knowing that if they actually do take this seriously, get engaged, get good grades, and get into BU, they can get financial needs accepted. So I think that's the last slide. Yeah. So we're really excited about community engagement. We actually do a lot of our scholarship and care based on what we can do in the community. And of course, we need community engagement in order to make sure that we're directed appropriately. Thank you.
Great, thank you so much for your presentation. Next, we're going to hear from Dr. David Sharp.
Thank you, Linda, and thanks for including me in the panel. I'll jump kind of follow on Dean Antman's comments. The Menino Scholars Program, the Community Scholars Program, are operated out of Wheelock College.
I'm sorry, I wouldn't have done that if I knew that.
I'm not sure I would have mentioned them until you brought them up, Karen, so it's great. They are tremendously important and a key feature for us. I'm just going to drop in the chat. I don't have a slide deck, but I'm going to drop in the chat a link to our strategic plan. And our Guide Star. Our Guide Star is focused on transforming systems in human development, including learning, as well as other human service areas, to really try to make a more just world, an equitable world. And we call it a Guide Star only because we wanted people to pay attention. So it really started internally to get us thinking differently about what guides all of our work. I think community engaged research and its role in promotion and tenure in education schools for a long time has been a goal. I don't think we've achieved it fully, but I do think there's a tremendous amount of energy put on trying to understand the needs of the communities in which we do our research and scholarship. Certainly, it impacts the way we think about our preparation of professionals, because like the med school and the dental school and others, we are inside the community when we're preparing people for these professional roles. I think there's now placed a greater emphasis on everything from development of research questions to thinking about involvement of research participants, conceptualizing the methodologies that can be used in ways that are going to actually answer and can be disseminated in a comprehensible way to community participants as we think about the research and scholarship we do. I think there are a number of gaps that still exist, though. I think that many of the highest impact journals that our faculty publish in are not always the ones that have been sensitive to this transformation. And so that then circles back to researchers choosing methodologies and approaches that are less community engaged than we would like them to be. And the vicious cycle, of course, is that impact factors that combine to help our faculty get promoted at an R1 institution are often negatively impacted by the places they publish, those very places that are more sensitive to the issues of community engagement. So we have work to do on, as allies and sort of activists, related to places where our research and scholarship is published and disseminated. I also think, however, that as we think about community engaged research, we also have to be, particularly as academic leaders, more mindful about how we build our faculty colleagues' expertise in public scholarship, as well as the research scholarship that often gets supported in promotion and tenure processes. And so I think we're on a journey, and a very important one, and I feel excited when I look at the kinds of things that Dean Antman mentioned. You know, there are many of those in our college as well. We're working with the Communities Academy in Boston through a Spencer grant to try to transform high school educational opportunities for children in an alternative atmosphere. We have faculty and postdocs and students working in elementary schools in East Boston, kind of helping build a community voice within the school and giving children and teachers agency as they think about the way they create their own educational experience and environment. We have faculty working across the country, in fact, globally, on issues that really start with community need and include community participants in the work that they do. So I'm hoping that there are opportunities throughout the conversation today to highlight some of these examples. So I'll stop there. Thank you, Linda.
Wonderful. We look forward to hearing more of the examples as well. So, Dr. Delva, would you like to go next?
Thank you, Linda, and thank you for having me and having this important discussion. And I'll echo what my colleagues Karen and David have said, that I think BU and definitely several of the schools here, and definitely our school's social work, is committed to doing work that involves partnerships and even beyond partnership, you know, the engagement that involves deeply listening to communities. It's not done across the board. Some people do it more. Linda, you're an expert at this. You're incredibly amazing at this. And actually, you know, Linda Sprague-Martinez is a clear example of a person whose community engagement, participatory action research has made a difference. And that was part of the success you are having, receiving grants, publishing, and having been promoted a couple of years, not too long ago, to associate professor with tenure. In social work, we're very committed to it. It hasn't been the norm over time. It has been changing in the past decade. There's been pioneers on this, and thanks to them, we build on their shoulders and move on. Prior to joining BU, I was the director of the Community Engagement Core of University of Michigan CTSA, the Center for Translational Science Awards, similar to BU CTSI. And I experienced directly the impact of working with the Flint communities, with communities in Detroit primarily, in building almost from a grassroots way the scholarship and knowledge, and And now, since I've left, I come to BU, some of those, and with new and better leadership, they've received millions of dollars that have helped transform those communities and help improve the lives of people addressing very complex public health problems and other types of socioeconomic problems, racial problems. There's still a lot of work to do. And one of the things that's impacting, where I think it's increasingly seen as favorable, with the caveat of what David, you just said, that it's the places that one publishes where they have the high H index factors haven't caught up yet on understanding that impact can be measured differently. And the example, Karen, you gave of a faculty with no publications, but whose work obviously is highly impactful, it's incredible. And I think that our job as deans and the faculty who are committed to doing community engaged research is to make sure we push the agenda, we push the envelope in highlighting how this work is impactful. And I think, I would say this goes across any field. I could be someone who just sit in the office doing administrative data analysis and crank out a lot of things, but if it's not shown that it's made an impact on anything or much, the nowadays increasingly, at least in the schools of social work, that is, people scratch their head. There people are looking for what is the impact of your work, whether you're a quantitative researcher, mixed methods researcher, qualitative researcher, an ethnographer, a community engaged. The more we articulate the impact of what our work, how it's making a difference on the topics we're trying to influence, that really goes a long way, and it helps counter the fact that maybe in some areas the publications do not have the highest H index factor. Because we can say, true, that hasn't happened, there's some historical reasons for that, but look at the impact. Thanks to this work, a community received the grant that helps improve some aspects of mental health services for their schools, their elderly residents, to clean up pollution. Thanks to this work, the legislators passed a law or a new policy that allows for these things to happen. And the more we can articulate that, the more favorably that work is viewed, despite the challenge of the traditional measures of H impact, where some of the journals just, they don't value this type of work. And within that is we can't do this alone. So this is a bit of a national movement, because when people are going up for promotion, if we're focusing on promotion, our ability as deans to articulate an argument in favor of a person's impact is when the peers from peer or peer plus institutions have reviewed our colleagues' work, and they're saying, wow, you have a jewel there. Their work is making an impact here and there. And this is coming from people who are highly considered in their field, in their area. So if they're saying, I noticed that thanks to this work of BU School of Social Work or Community X has been transformed thanks to this work, or the way we think about a problem has been transformed, that is a gift to us when we look, because I can agree with that, but then you have 8 peers out of 11 who say that. It's a gift I'll take, and we'll run and we present that to the next level of review. So documenting impact, making sure that peer institutions are doing the same thing. When I review for them, I'm looking for that. Someone could have a ton of publications and other things, and there's no difference. I'll acknowledge that that's hard work, and I congratulate the person for that level of scholarship. But I will make a comment, a critique about, has this made a difference? Has this moved the needle on the work that they say they want to move the needle? And so that is increasingly becoming more common. It's still a journey, though, as David has said. And yes, within our school, we value it tremendously. I'll stop there to allow others to talk.
Great, thank you so much, Jorge. Dean Galea.
Hello, yes, good afternoon, everybody, and thank you very much, Linda and Dima, for arranging this and for inviting me. So to keep my comments brief, public health is really, the definition of public health is about engagement with the general public and with the community. When public health is what we do together to create a healthier population. So I think there is very much community infused as part of the ethos of public health. And I don't think any faculty member or student in public health or staff member see community engagement as very far from what we do. Just to be operational, we at the school since 2015, we've had a core purpose, which we call Think, Teach, Do for the health of all. And we use that to articulate our scholarship, our education, and our practice. And just to talk about each of those for a second. In terms of our scholarship to Think, a lot of community engagement happens at the level of individual faculty, students, and staff working with community organizations. So for example, a lot of our faculty in our environmental health department do excellent work with community-based organizations, many of them in Chelsea and in other neighborhoods. We have a lot of our faculty in our community health science department who do work with community organizations around violence. We had one of our annual reports in 2019 summarized the full suite of our community engagement, and I'll put a link up for that annual report in the chat. In terms of the teach bucket, all our students do a practicum. It's one of our requirements for our MPH students. Those practica can be with any number of organizations, but a majority of them tend to be with community-based organizations, creating a fairly dense network of engagement with community-based organizations. We also have several courses that we teach that are practice-based courses that integrate community organizations with our teaching. And our MPH is structured with interdisciplinary certificates, and we have several certificates, most notably one the students call CAPD, which is about community assessment, program design, implementation, and evaluation, which teach students how to engage with community engagement. In terms of our do, which is our actual doing and our centrally driven engagement with communities over and above what our faculty, staff, and students do, we see that as following under a couple of pillars. One is the actual action that we do in partnership with particular groups around areas that are consistent with our strategic mission. A lot of that falls under our Activist Lab, which is run by our Dean of Practice, Greg Andrade. And the mission of the Activist Lab is to work with community organizations locally and nationally to develop approaches that can improve health and potentially to have those taken up to scale. Then we also have community engagement in the form of our communication and translation. We see part of what we do as a central role is to translate the science and make that available to community organizations. And we do that in multiple ways, but principally we have our public health post, which is part of our communication suite that engages students and other people to actually translate the science. And then we do a series of public health conversations, which are sort of seminars, in-person, webinars, etc., all of which are free and open to the community. And all of those we see as part of our engagement with the community. So broadly speaking, I think community engagement is a core definitional part of what public health is, and it is it sort of penetrates our think, our teach, our do. In terms of, just to end on the last point that we're asked to address, which is faculty involvement, faculty promotion, our metrics for faculty promotion are, as they are for all the other peer schools, national, international reputation and achievement, and advancing the field in its own way. So we're well aware of the fact that sometimes community engagement, community participatory approaches may take longer for faculty, and there are many different ways in which we try to make sure that we nurture faculty to make sure they can still succeed, even with making community engagement a core part of their work. And there's different ways of doing that. We also have multiple different tracks for promotion, all of which are very much equal and in our school. And we try to make sure that we match the faculty interest with the track that the faculty should be on, depending on the type of work that the faculty members engage in. And I'm happy to talk more about that in the Q&A. Thank you for having me. I'll stop there.
Dr. Galea. Next, we have Dr. Moore.
Thanks so much for inviting me. First of all, I wanted to express my appreciation of the CTSI and the leadership and all of the staff that support the CTSI. It's an incredible resource for all of us here at BU, and it's been particularly important in some of our training grants, and so we're very grateful for the work that the CTSI does. And then specifically, thank you to Linda and Dima for putting this program together today. I think it's a great opportunity to learn from each other about how we're doing these things. Let me put this up. Are you seeing this okay? to tell you a little bit about what's going on at Sargent. So community engagement is really intrinsic to our strategic priorities. I thought I'd put these up here just to show you, if I can get this. Oh, so here's just a little graphic that shows some of our strategic priorities currently. Health data sciences is one, but health equity is one of our primary ways that we focus ourselves on engaging with the community. Also, we find that patient-centered practice is an important part of our engagement and working across the professions. So our various clinicians and students are able to best engage with each other in these community settings. And then another of our priorities is translating our research and implementing that change in line with the strategic priority of BU to do research that matters. This is how we see implementation at scale of some of the best practices that we've developed here. And then, of course, to make all of this really impactful, then we also work with health systems and health policy. So is there a question? Yep. So just to give you, just a real quick few examples of how we implement these strategic priorities, how we address these. We recently hired Emily Rothman, who many of you know from her role at the School of Public Health. She's now our chair of occupational therapy, and I think her, if you're familiar with her work, I think it's indicative of how we have embraced this community engagement in our Department of Occupational Therapy. We have a new faculty position, a clinical assistant professor created in health equity. Similarly, an assistant professor in nutrition and epidemiology, and another clinical assistant professor in prenatal health care and health outcomes in Black women and their infants. So those are very, very important decisions in any school's operations, is what faculty hiring decisions you make. And so hopefully you can see, that we have prioritized this in our faculty skill set. Just to let you know a little bit about what Sargent is, since many of you may not be familiar with Sargent, I want to encourage you to, reach out to our faculty for collaborative opportunities. But our departments include occupational therapy, speech language pathology, physical therapy, and then programs in nutrition and a program in health sciences, which provides undergraduate preparation in a number of fields, but a lot of those students are interested in pursuing graduate degrees in public health. We have about 1,800 students. 600 of those are involved in many hours of clinical practica that are occurring in the community. So a lot of our community outreach occurs in a training setting, not necessarily in a research setting. But our 75 faculty members, 25 of whom are tenure track, 50 on the clinical track, can often leverage those opportunities where you have students doing clinical practica into scholarship opportunities. We have about $18 million in federally funded research. A lot of that goes into community-focused projects. A few examples, I won't go through all of these, but we work with our clinical partners. There are hundreds of clinical partners throughout the country that we engage with. We had a recent webinar on anti-racism in healthcare. We have, for example, going down the Blackstone Community Center, where we do a nutrition program for adolescents and young adults. I mentioned the perinatal care for women and infants. We do large-scale implementation of interventions for employment, the Department of Mental Health, and then we have specific projects going on with departments of vocational rehab in New Hampshire, Oregon, and Georgia. Working with adults who have hearing loss, and the Hearing Rehab Foundation of Massachusetts, we have a loneliness outreach project. We do peer academic support of college students with mental health conditions. That's across the country. And then self-management and severe mental illness. So And then also addressing food insecurity. So you can see a full range of things where chronic care is injected into our training programs, and that leads to community outreach and comes back to us in the form of research opportunities and large-scale implementation. A few of the tactics that our faculty have engaged in this is, for example, I mentioned Emily Rothman. She engages BIPOC adults with autism nationally to serve as experts on advisory boards. And this is just a terrific model to include in our subject populations members of those affected communities. And that is something that is spreading very quickly through our college, as well as on advisory councils. And then direct outreach, I mentioned the Blackstone Community Center. We also have direct outreach through a new neurodevelopment clinic, Newton Wellesley. And then pro bono services are a normal part of our in-house clinics, where we reach out to many different parts of the community, invite them into our clinics, encourage them to seek out our clinics for pro bono treatment. That sort of summarizes some of the things that we're doing. I wanted to add that in terms of promotion, community outreach is sort of an assumed part. So the question that sort of underlies this discussion today about how community outreach works in our college and works for or can even work in opposition to tenure or promotion objectives that was actually a little bit of a foreign question to me. Because it's a natural part of our faculty's activities. But I think that the challenge for our faculty comes in the form of the required time commitment. Standing up a community, a project that has intensive community outreach and doing it in a way that would support especially a tenure calendar kind of a decision is really difficult. And so having the kinds of community outreach programs that many of us have talked about, where a faculty member could sort of step into that existing program, conduct a more focused research project, and bring that out as a research project that then would be, a peer-reviewed scholarly work is an important part of what BU is all about. We have the infrastructure that supports that kind and encourages that kind of involvement. And I think that's been key. The last thing I'll say is that for our clinical faculty, our definition of scholarship is quite broad. So it includes things, I think, as Jorge and David mentioned specifically, it includes things that may not be, sort of prototype, peer-reviewed, high impact, H-index, generating kind of a product. So I'm happy to get on with questions and answers, and thanks again for having me.
Wonderful. It's so wonderful hearing from all of you and the work that's happening across schools around community engagement and the different programs. I'm going to ask a couple questions, and I'm paying attention to time, so I want to make sure we have enough time to hear from the audience as well, because we have a number of folks with us today. And we had questions that came in advance as part of the registration. I want to draw on a point that David and Jorge, you brought up around some of the challenges. Also, Chris, you talked about in terms of time. I wonder, and Sandra, you talked a little bit about supports that you've put in place. I wonder if we could talk a little bit about what are some of the specific challenges that you see community engaged researchers coming up against as they're going out for promotion, some of the successful practices you've seen that maybe we can learn from, and supports that you've been able to put in place to support community engaged researchers or participatory researchers going. So it's a big question, but thinking about really the goal, how do we mitigate challenges so that we can support community engaged researchers and really encourage more participatory research, because we do often see that folks are holding off on it, not to do it as part of their dissertation or to wait till after they're tenured. So how do we get folks feeling comfortable really working in partnership with community now, given time constraints?
Well, maybe I'll jump in, Linda, since you called on me, and then my colleagues can jump in. I suppose philosophically, we think that we want all our faculty to succeed, and we recognize that different faculty have different goals, which we want to respect them in. And community-based research poses its own challenges, and I would argue they're different challenges. They're not unique. It's not the only group of faculty who have challenges. So the way we've approached this really has been through a fairly comprehensive investment in faculty development activities. So we have all our faculty are matched with a faculty mentor. We have a number of very formal efforts for faculty development that faculty participate in. We are in the process of putting in a mid-rank career review, and we are fairly hands-on in trying to make sure that every faculty member we hire has all the tools at their disposal to succeed. So I'm not sure that I actually know, and I don't think we have any here, and I'm not sure I know in my previous lives and other places, particular efforts that help faculty who are specifically involved in community engaged research. But the way I see it, it's community engaged research presents a set of challenges that any faculty member who's interested in doing it will benefit from partnering with other faculty members who have done it successfully, which is where the mentoring comes in, and which is where the faculty development investments come in. One of the other last things to mention is one of the things that we've invested particular resources in is a fairly extensive suite of pilot programs that faculty can apply to. And that's particularly helpful for faculty in different areas. And for community-based research, it's particularly helpful because it allows faculty relatively easily available resources to be able to launch pilot programs that then provide data that can lead to larger funding. And we found that to be a really immensely successful activity. I'll stop there.
Sorry, I'll add a couple of things to Sandro's comments. One, I think, is as academic leaders, trying to leverage our relationships with networks outside of BU. So I am drafting a statement from the AAU Deans of Education related to this issue of community engaged research, momentum around community engaged research and its relationship in R1 institutions to promotion and tenure issues. I think another is trying to make sure that we have community embedded leadership. So we have an associate dean whose primary charge is to be in the community, building relationships with those agencies like public schools and nonprofits, where we can then more readily access community members and include them in our research partnerships. And then the third one is investments in institutes that cut across the university. I mean, BU is, it's sort of a perversion of riches here. There's many people doing incredible work, but our ability to work together is not always easy. And I'm proud to say that my dean colleagues here have been very supportive of our Institute on Early Childhood Wellbeing and trying to have faculty from across the university engage in joint grant writing and projects. I mean, community members, community participants do not think in silos. When they think about the needs of children and families, it's not specific to OT or specific to education. It really cuts across multiple sort of needs within a family or a child's life. And unfortunately, historically, we as researchers have not thought that way always. And so those kinds of shared projects that we have as academic leaders, I think will help set our faculty up for success as they begin to really focus on the kinds of questions that community participants are going to be asking us to center our research around.
Ruth Paris has actually asked the question. It says, how are we setting up our faculty to actually do this kind of research, which may take more time than running an experiment in the lab, which gets rewarded with promotions. And I think it all comes down to faculty development. On the medical campus, we have faculty development for various groups that's available to all three schools. But we specifically have K to R work. We have a kind of like a K workshop, and then we have K to R workshops. And any kind of research can be included in these. We also have substantial pilot grants that go out from the CTSI or the Dean's office. We have a grants writing office that's often very helpful, particularly for people who've never written a grant before. we have 8 people in that office now, and if we've done anything for the faculty, it's the one thing that they say was the best thing we ever did, because it basically holds their hand while they write their first grant. And the other good part of it is that if we have a really complicated grant like the CTSI that requires multiple departments and schools even to collaborate, they're there for that kind of multi-departmental collaboration as well. So I think that it really is providing wraparound support. The development office goes after foundation grants for our junior faculty too. And a lot of the foundations really do care about research that matters, and they define research that matters as research that matters to our communities, so that they're very likely to hire or to support our junior faculty in those kinds of projects.
And if I may add, from in social work, we've never, at least since I've been here, turned down good ideas. People might approach and say, I'm writing a proposal with partnerships and would like them to be very involved. Could we have some support for that? Funding is available for that. We support that type of work. And I also do a lot, as David, you were saying, a lot of work nationally, because as I mentioned earlier, a lot of, when we request 12, 15 letters, external letters from our peer institutions, we may have this value and we may be supportive, and our job would be so much easier if they do too, and vice versa. So I do a lot of direct I would call it lobbying, and indirectly with fellow deans from the top 40 ranked schools of social work, where, usually from the top 20 ranked schools of social work is where we're going to seek letters of support, so that their deans and I and others are in cahoot in thinking about the importance of this work and giving it its proper value given the challenges we experience. So I do a lot of that through presentations that I do with the National Associations of Deans and Directors in Schools of Social Work, through my own presentations. I'm constantly planting the seeds, pushing the envelope, having conversations, asking questions. How are you doing that? And the question is a biased question. It implies, how are you doing this towards making certain progress? Not how are you doing this so that we don't get something done. And because I think that's important, the letters come from outside, and at the university level, they really put a lot of weight on those external letters and what they say about the person's work. And so I that's some of the work I do externally as well. And of course, in social work, we have a lot of partnerships, and the question about time is a little more difficult. I think people conducting intervention research may fall on this category as well, and a few others. And that's, if the tenure track clock is 5 years or 6 years, and you're racing against time, that's a little bit more challenging to answer. But as far as support, philosophically and concretely, there's no question we do that.
You know that people in labs they never do research. There's no such thing as a single author paper or whatever. So we need to get a team that's working on this, maybe because each school has a limited number of these people. We need to get them into their own lab where they can work together, get on each other's publications. Somebody from the education school could be doing research in early childhood education, whereas one of our pediatricians would be doing it on asthma. I mean, they're overlapping study people. So together we could actually have a group of people who work together and get on each other's papers. And once you get those things started, they're like virtual cycles. They tend to increase productivity in terms of research. No laboratory person would try to write a paper on their own.
Mm-hmm.
With you, Karen, it's part of our CE networking series. It's through the CTSI, is trying to bring more people together who are doing this work. So Dr. Moore, you had a point you want to add?
Yeah, I would just, return to and sort of emphasize some of the points that folks are making, bring it to the institutional level in terms of how we can support scholarly output in community engaged activities, these relationships take a lot of time, just the relationships themselves, never mind the project. And so, those may exceed the sort of the interest of an individual investigator in some cases, so that the relationship itself and sometimes the activities represent part of our infrastructure. So I can think of a number of our centers, like so we have a breast cancer support group, for example, or a aphasia resource center. Those exceed the reach of an individual investigator in cases, and other people can come in, as I mentioned before, do these projects, have a focused impact, and then others can come in and work on the implementation and the dissemination and the scaling up of those findings. So it really needs to be a team effort that has to be supported at the institutional level, and that it can't be allowed to sort of be lost when federal funding lapses, for example. So one of the things we can do as an institution is commit to those relationships and supporting those relationships.
Great point. I'm mindful of time. We have about 10 minutes left with the deans. Are there additional questions from the audience that folks would like to have? We have a great conversation on metrics going on in the chat, and the whole idea of what is impact. I don't know if David, do you want to talk a little bit about that?
Well, I just wanted to say one more thing. In advance of our meeting today, I reached out to John Zaff, who I see is in the audience, and he was mentioning to me a number of things we've touched on. But one of the things that community engagement, to add to Dean Moore's comment, these relationships take time because they require trust. And the history of doing research in communities have often been rushing in, grabbing data, going out, and then doing what we need to do to get our interests met. And one of John's many important comments to me was that you have to develop an ownership of the research that you're doing that is co-owned by the community participants. And that in and of itself is complicated because it requires thought about what do the community participants own? Is it the findings? How do we include them in dissemination practices? How do they feel like they're part of a team that can then come back and work on answering more questions? And so in addition to all the complications around promotion and tenure, I think sustaining these relationships once you've created them is incredibly complicated and time consuming, and but really critically important to the long-term success of our research teams.
Additional questions? I see Catherine Lusk from the BU Initiative on Cities has put a question in the chat. Catherine, do you want to just chime in and ask that question? Opposed to me reading it.
Sure, thanks, Linda. I just, in some research at other institutions, I know that some institutions of higher education have identified a grand challenge, which is really a shared goal or shared area of impact that cuts across multiple academic institutions, multiple units, multiple silos. And I'm just curious if you all have ever talked about a similar notion where our sort of collective human capital is jointly shared and collectively directed to make change. And I hate to put an example out, but something like addiction and recovery is one field where there's huge need in our region, and it cuts across so many of our schools and age groups and expertise.
Let me jump into that. I see David put a note about some of the centers. I think a lot of that at the university level exists in the university-wide centers. I think it's less of a challenge as in a particular problem and more of an area. And I think the university has, I don't remember the latest number now, more about a dozen university-wide centers. Obviously, Catherine, you sit in one of them. And I think that represents the university's cross-unit commitment to these things. I did want to point out that within the School of Public Health, just for people who don't know, we've, in our last strategic plan, we articulated 5 cross-cutting areas that are perhaps more in line, Catherine, with the kind of issue-based focus that you're talking about. And when these are climate change and health, mental health, infectious disease, health inequities, and cities and health. And when we're using those to invest strategically across departments, trying to break those silos. So I think at the university level, you have these centers and other programs that bridge things. And then within the schools, of course, different schools have different approaches. Whether at the university level, we should do something and say, use your example of addiction and say, can we invest our collective brains and resources into that? I think it's an interesting question, but what I've seen in most universities is more what we're doing, which is these university-wide centers and initiatives that bring people together.
I would follow Sandro's comment only by saying, I think the process at BU remains quite opaque. Like, how do you, if we were to say as a group of faculty or deans, we would like to chase a particular challenge, it is not clear to me yet that there's a transparent path for how you do that. So I would put that out there to the administration to help us think how you would do that. And maybe Catherine, in your role as one of those university-wide centers, we could leverage the Institute on Cities as a way to think about that.
It's interesting from a standpoint, and I saw the lady, you just came on camera. I don't want to call you out or anything, but I'm thinking about our very first community engagement networking forum where we had a breakout room with 3 different researchers from across schools partnering with the same organization, but not knowing each other. And I do think when you think about systems-wide structures, there are a lot of folks from BU schools out there in the community doing amazing work. And do they talk to each other? I don't know if the lady you want to.
I was going to say, when I've been here for 10 plus years, BU is an amazing school in that we do a lot with the community. The problem has always been that we're siloed, so that your right hand doesn't always know what your left hand is doing. And so it's not unusual to be in settings where somebody from the School of Medicine or somebody from the dental school or somebody from Charles River could be in the same setting. And so that's why I think the project that Jake put together was so important, because what it really did was there were over 200 programs that he listed. He had contacts and the like. And when you look at the sheet, you have, Catherine's group, you have SPH, you have Wheelock, you have the medical school, you have dental, you have law, and it's amazing all of the resources, all of the connections we have that we just don't talk about. And we overlap, as David mentioned, in many, many ways. And the community just doesn't always know what we do. And we don't always have a good record of what we do, but I think that we're starting to get a better record. And if we can add material to the community partnership program that government and community affairs is putting together, I think it would blow your socks off when you see all of the activities that the school itself, the BU itself is doing in the community. I'm actually very proud most days to be community relations.
One of the things that I think it's so true what you just said, that when we look at what BU does and its engagement, it's incredible. I don't think it's just well known across the community. But going back to Catherine Lask about the question of, like you use an example of addictions as a place to bring us together, and Sandra and others were talking about that tends to occur at the institute centers level, and I see why most universities have that approach, that those synergies occur at the Center for Anti-Racist Research. It brings people together. Initiative on Cities, and it brings the new institute on children well-being, brings people together with that focus. Because I think if a group of us deans got together and said, let's focus on addiction, then there will be like 90,000 people saying, wait a minute, there's hunger. And then there's another 90,000, whoa, that's very important. We got to eliminate hunger. But I think BU should focus on housing. And somebody else would say, and so I think that as a group collectively, we cannot focus on all the challenges that exist, and one would have to make choices. And by making those choices, you're therefore not including other important aspects. Whereas by having the different institutes and centers that are narrowly focused on a particular topic, they can bring people together and be the channels of that synergy together, as opposed to this other level that one could imagine. I think was it University of Pennsylvania, one of those at one point made a decision, we're going to focus on, based on the former president's there's work, say we're going to focus on poverty and housing, and the whole university kind of move from outside, from what I understand, move that way. But that tends to be more rare, because then there's, you know, all the other things that people do. Why are we coming together on race and literature and civic participation and learning, teaching people to read between the lines, or and sort through fake news, for example? That seems to be, you know, more important than anything else nowadays. We got the science, we got these things, and we still have people who believe in fake news. That why isn't the university focused on that? I'm just throwing examples, but so I think it's through the smaller institute that focus on HIV/AIDS, the CTSI. Some are disease agnostic. I understand that. So, but yes, BU and your institutions at large do a lot. It's just that oftentimes it's not known, and there's always tons of room for improvement. I mean, there's no question. Just because people do a lot doesn't mean there isn't room for improvement.
Great, many great points. I know we have about a minute left. I want to thank the deans for starting this conversation with us today. Clearly, we have a lot more to talk about. As a group, we encourage you to come to our events around community engagement. I'd love us to think about what would it mean for a community to drive a center at the university. That would be an interesting thing for us to think about. Next month, our speaker series, we're going to be hearing from Carly Britton, who's a project director at Healing Community Studies. She's going to bring a team of folks. As you may or may not know, Healing Community Studies is one of the largest studies of its kind, focused on reducing fatal opioid overdose in 67 communities, and Massachusetts is one of those communities. And we're working with 16 distinct municipalities and clusters across the state. And Carly's going to talk to us about what does it mean to subcontract with all of those 16 communities and find partners within them and stand up interventions and bring together coalitions, the financial aspects of all that, and what does it look like administratively. We had a few administrative questions in the chat, so we're going to be able to dig into that. But again, our team will stay online if you have questions after. We are thankful that you all were able to come today, and have a great rest of your week and weekend and holiday season.
Thank you.
Thank you. Thanks for the great comments.
So
Thank you so much.
Fascinating conversation.
Thank you all.
Thank you.
Thanks for
Belinda.
joining us.
Is there a way of coordinating the people from the various campuses? And I think the CTSA could definitely take a leadership role in this, because there really is no need for each school to have their